We've got this term, Psychoeducational Skills Training, or PST for short. And really what the PST sessions are focused on is a mix of education and psychological support. And we'll also be learning specific psychological skills to help manage pain from PDD. Namely, we'll be looking at thinking skills, specifically skills that are based in cognitive behavioral therapy, or CBT for short, and also mindfulness skills. And at this point you might be wondering, why would we want to use psychological skills to help manage pain? And so I'm going to draw a rudimentary drawing of the brain. And basically what we know about the brain when it's experiencing pain that recurs or is chronic, like PDD pain, we know that there's lots of different factors that are involved. So in addition to the sensory parts of the brain that are feeling the pain stimulus, we know that the frontal cortex is involved, so the part of our brain where thought comes from, and the thinking part of the brain. We know that there's a part of the brain called the ACC, or the anterior cingulate cortex, which is involved in emotional thinking. That gets activated with chronic pain. The amygdala, which is the part of our brain that's responsible for really deep-seated emotions, such as the processing of fear, that becomes activated. And then we know that the hypothalamus, which is the part of the brain that monitors our stress response and is involved in stress, that becomes activated when we feel chronic pain as well. So much so that we know that these areas, even when someone's just expecting pain, so they're not necessarily even feeling pain, but they're expecting pain, that very similar areas, as I've illustrated on the board here, light up with that expectation of pain. Which is really good news for us, because it means then we can learn specific psychological skills, thinking skills, mindfulness skills. We'll be talking lots more about these in the group. We can use these skills to try and manage our pain experience and change our relationship with PDD pain. Does that make sense? Any questions at all?
I mean, I use mindfulness for stress, but I haven't really thought about how one could use that for pain. So how can mindfulness work for pain?
Using mindfulness for pain. That's a great question, and probably some of you are also wondering, why might we use mindfulness for pain? So we're going to be talking a lot more in this group about what is mindfulness and how might we use mindfulness skills for pain. And I'll also be asking you, inviting you to think about this question more and more as you go through the program and as you're actually practicing some mindfulness skills on your own. But in brief, what we know is quite interesting, because we knew for a long time, for many, many years, that mindfulness was effective in terms of reducing pain. But we didn't necessarily know how was it effective, or what mechanisms might be responsible for producing this reduction in pain. And it relates back to the brain and the central nervous system. So we know that when people have been practicing mindfulness over time, that there are changes that occur in their brain and their central nervous system. So that it actually starts to affect how they're processing pain. So people who do mindfulness actually feel less pain, so they're less sensitive to pain. When they're paying attention to pain in a mindful way, they actually feel less pain in that moment, so their pain intensity goes down. Okay, so we'll be talking more and more about this, and I'll also be inviting you to think about this question of why might we use these types of